Today, we are going to look at a BodyViz brain builder about the male reproductive system and the surgical procedure termed a vasectomy, which is a form of male birth control. The three functions of male reproductive organs are the production and maturation of the male gametes, termed sperm, the transportation of sperm to the exterior of the body, and the production of seminal fluid, which activates and provides nutrients to the sperm and produces buffers to counteract the acidity of the male urethra and female vagina. The male reproductive system is composed externally of the scrotum, testes, and the penis, and internally of the epididymis, ductus deferens, seminal vesicles, prostate, and urethra. The scrotum is a pouch of pigmented pelvic skin containing the testes and the proximal segments of the male reproductive tract. It also contains nerves and blood vessels. The scrotum is subdivided into right and left compartments by a connective tissue septum. Each compartment contains one testis. The left testis hangs at a lower level within the scrotum than does the right testis. Each testis contains 400 to 600 tightly coiled seminiferous tubules where sperm formation occurs. The male reproductive tract is responsible for transporting the sperm to the exterior of the body from the testes. The epididymis is the site of sperm maturation and activation. In this process, the sperm develops the ability to move and fertilize the female ova. The epididymis is a long, coiled, single duct that connects the testes to the ductus deferens within the scrotum. The ductus deferens is a muscular tube that passes from the scrotum into the pelvic cavity, eventually joining with the duct of the seminal gland and forming the ejaculatory duct. The ejaculatory duct passes through the prostate gland and empties into the urethra. The urethra travels through the prostate and enters the penis. The penis is composed of two parts, the root and the body. The root of the penis is posterior to the scrotum, and the body of the penis is covered with skin. Next, let's learn about a vasectomy procedure and then go over a patient example at the end of this brain builder. A vasectomy is a form of male birth control that has a very low risk of complications. It is typically performed as an outpatient in the physician's office under local anesthesia, and the procedure typically takes less than 30 minutes and is more than 99% effective. The typical procedure involves numbing the surgical area by injecting a local anesthetic into the skin of the scrotum. A small incision is made on the superior anterior portion of each side of the scrotum in order to locate the right and left ductus deferens within the scrotum. Small segments of each right and left ductus deferens are externalized through each corresponding incision of the scrotum. Each ductus deferens is then cut, and the proximal and distal segments are either permanently sampled, cauterized, or tied to prevent the passage of sperm through the cut segments. The cut segments of each ductus deferens are then repositioned within their respective sides of the scrotum, and the incisions are sutured closed. Following the procedure, the patient is advised to ice the affected area of the scrotum for 1 to 2 days, wear tight-fitting underwear for approximately 2 days, and to refrain from any sexual activity for approximately 10 days after the procedure. The male will ejaculate some seminal fluid during sexual activity following a vasectomy, but the fluid will no longer contain sperm. Finally, let's take a look at a patient example. Your patient has come in today to talk about a vasectomy procedure. You review your patient's file and history. Age, 32. Sex, male. Medical history, his tonsils were removed at the age of 14, with no other medical complications noted. You enter your patient's room and explain the vasectomy procedure to your patient, including any possible risks and complications. Your patient explains how he is interested in a vasectomy procedure because during the delivery of his third child, his wife experienced some complications that caused her doctor to recommend not having any more children for the health of his wife. When exploring birth control options, your patient and his wife decided a vasectomy would be the most fitting option for them. You schedule the procedure, and the procedure goes well and takes only 20 minutes. Your patient is able to return home that night. This is a classic example of a vasectomy procedure. Want to see more 3D anatomy? Check out BodyViz 3D Dissection Software, an online learning portal with active learning modules, automatic grading, and real patient anatomy. Go to bodyviz.com to learn more.